the number of hospitalized cholera cases has risen to 258 in the last 24 hours. This comes at a time when 5 suspected deaths were recorded, while there are 167 new suspected cases. Under the suspected cases, Chiredzi with 30, Kuwadzana with 23, Glenview 17 and Chipinge at 17 have some of the highest cases. Harare remains the epicenter of the outbreak at a time when 258 suspected deaths has so far been recorded across the country, while 67 were confirmed. Currently, the recovery rate stands at 96%. With the coming of rainy season, experts have warned the situation could get out of hand. But perhaps the biggest question will be, how are neighboring countries handling their situation, if there is any at all? Now, in 2023, Malawi experienced its largest cholera outbreak in the past 20 years, with 59,075 cases and 1,769 deaths as of October 2023. The outbreak affected all 29 health districts in the country. The outbreak started in March 2022 in Machinga district and was declared a public health emergency by the state president in December 2022. The outbreak was worsened by the rainy season, which increased the transmission of the waterborne disease. This is, however, against the background that the Presidential Task Force on Coronavirus and Cholera announced that cholera is no longer a public health emergency as of August 2023. And last month, Zambian authorities announced they were stepping up their health campaign to combat cholera, a disease that has been on the rise since October and has already claimed the lives of nearly 100 people. The health minister has since called on more drastic hygiene measures in households, and her counterpart in charge of water, Mike Maposa, said that chlorine would be more widely distributed to disinfect contaminated water in the regions most affected by cholera. There have been 93 deaths in 2023 from this acute diarrheal infection, most since October, according to the National Institute of Public Health. And in Mozambique has also been battling the most severe cholera outbreak in the country in more than 20 years. The number of cases of cholera increased after the country was hit by Cyclone Freddy in late February 2023. The coastal town of Quilimane in northern Mozambique became cholera hotspots. At one point, the World Health Organization, the United Nations and Doctors Without Borders were treating more than 400 cases a day. The numbers have since come down. Mass vaccination drives and community outreach programs, particularly targeted at pregnant women, have played a part in stemming new infections.